Good afternoon. This series of videos is Healthcare Advocacy, where we address problems in the healthcare system, take actions, and then hopefully make a better system for all of us. I'm Alan Unell. Before we get started, let me point out that down below in the description area, we'll have a link to the Healthcare Advocacy newsletter that is the text for today's talk. In addition, that newsletter will have all of the hyperlinks and all of the references that I mentioned, together with all the actions that I recommend. Okay, in yesterday's newsletter and in yesterday's video, we talked about Medicaid unwinding. The post-pandemic process of Medicaid recipients having to reapply for coverage and many of them losing coverage. We noted that about 13.3 million people have lost their Medicaid coverage, that 2.48 million of those that lost coverage were children. Now, it turns out that 60% of these children come from the following states: Arkansas, Florida, Georgia, Idaho, Montana, New Hampshire, Ohio, South Dakota, and Texas, all Republican-led states. Now, the 10 states that refuse to expand Medicaid with the Affordable Care Act from the federal poverty limit to 1.4 times the federal poverty limit for low-income adults, they have disenrolled, those 10 states have disenrolled more children than all of the expansion states combined. Those 10 states are Alabama, Florida, Georgia, Kansas, Mississippi, South Carolina, Tennessee, Texas, Wisconsin, and Wyoming. Health and Human Services Secretary Javier Becerra sent letters to the governors of all 50 states in June of 2023, just as Medicaid unwinding was starting, urging better protection of children. So if they don't have to lose Medicaid, they don't. In this letter, he has a list of strategies that states can employ to help protect recipients and especially those children. The particular strategies are in a hyperlink that's in the newsletter. You can go and read those. So today's actions are to help those kids get their health care back. Now, let me point out one other thing for you. On December 6th, the Center for Medicare and Medicaid Services, CMS, put out a proposed new rule to, in quotes, encourage states to behave better during the Medicaid unwinding. It actually gives CMS a lot more oversight and leverage with each of the states to make sure that they behave properly. Okay, look. If we had universal health care, we could be spending this quality time talking about lots of other important things, but we don't. Okay, here's the action. This is a real simple one. Let's tell our members of Congress and senators to pass legislation to protect children's access to Medicaid during and after this unwinding. That's it. Now, there will be a link in the description area you can click on, and you can get a hold of the email or phone numbers for your representatives. Or if you have a cell phone, you can use RESISTBOT to send a pre-written email, like I did, to your member of Congress and senators. RESISTBOT will know who they are for you. All you have to do is text SIGN, S-I-G-N, PEBBOA to 50409. And here's the email you'll send. I'm your constituent, and I just found out that 2.48 million children lost their Medicaid insurance in the post-pandemic unwinding. I want you to pass legislation to protect children's access to Medicaid during and after this unwinding. Thank you. That's it. Real easy. Now look, there's an extra credit action you can take. If you live in Arkansas, Florida, Georgia, Idaho, Montana, New Hampshire, Ohio, or South Dakota, or Texas, you can send a letter to your governor and state legislators and ask them to adopt the measures outlined in Secretary Becerra's letter to the governor from last June. There is a link that I'll put in the description area so you can get their contact information. And here's a template email you can send. I am your, my name is, and I'm your constituent, and I live in this zip code. And I understand that our state has a very high number of children who have lost Medicaid insurance during the post-pandemic unwinding process. Secretary of HHS Javier Becerra sent a letter to all state governors in June of 2023 with actions we can take to help protect those children. I want you to take those actions. Please protect those children. Okay, the last action is an extra credit action, if you will. It turns out that the Center for Medicare and Medicaid Services is now taking public comments on those new rules I mentioned up above to give them more leverage with the states. The set of rules is called CMS Enforcement of State Compliance with Reporting and Federal Medicaid Renewal Requirements. I know it's a mouthful. There's going to be a link in the description area to the action. You'll have to select, copy, and then paste it into the URL, or if you go to the newsletter, it hyperlinks. Okay, here's the set of, they're taking comments until February 4th, 2024. So we have a little time, but the sooner the better. Here's what I told them, just so you can have an idea of what to say. I said, I heartily approve of the new rules. I'm so saddened to hear that as of today, according to the Kaiser Family Foundation, 2.48 million children have lost Medicaid health care. This will help provide the access to care that so many need. Thank you. Real simple. Okay, we have one more topic for today. It's private equity and mortality. I received a note from a reader who's a physician, and she asked if I could discover something about what the effect of private equity investment in healthcare is on mortality. In previous articles, we've noted that when a hospital is purchased by a private equity fund, the patients and the community typically suffer. There are a lot more accidents, more infections, and a loss of services that are unprofitable. That's often like labor and delivery out the door. Anyway, at that time when she asked, I had no information about mortality. So I went to work. Here's what I learned. A study was conducted by the University of Pennsylvania's Atul Gupta, NYU's Sabrina Howell, Chicago Booth's Konstantin Yanelis, and NYU's PhD candidate Abhinav Gupta. They reviewed 18,000 nursing homes. Their study was nursing homes only. And the bottom line that they found was that when private equity purchased the location, the death rate went up by 10%. It's horrible. Their source was Medicare and Medicaid data covering more than 18,000 U.S. nursing homes between 2004 and 2019. During this period, 1,700 facilities were purchased by private equity firms. What's behind the surge in the death rates? Well, it's partly due to staffing cuts. They cut staff to cut cost because they have to generate a quick profit to their equity customers. The researchers found an average reduction in staffing of about 1.4%. And after the private equity companies bought the nursing homes, there was a 3% drop in the number of hours that nurses and other staff were paid to provide basic services like hygiene, infection management, and monitoring or bed turning. These routine tasks are critical to well-being and health outcomes, particularly of older patients. The staffing reduction at private equity-owned firms seems to have gone hand in hand, though, with an increase in the use of antipsychotic medications. The study also found a 50% increase in the use of such drugs in private equity-owned facilities. The sad part is that those drugs are known to increase mortality in older institutionalized patients with dementia. So they can't quite look after the patients at the same level, so what they do is they essentially keep them quiet with antipsychotic medication. I don't have anything good to say about this. With respect to hospitals, the data is confounded. That is, there's a mixed message. Here, there is a link to a news story, it'll be in the newsletter, about a recent Journal of the American Medical Association publication about private equity's impact on patients in hospitals. By the way, there are 386 hospitals that are fully owned by private equity funds. That's about 9% of all private hospitals in the US. The study reviewed, are you ready? 5 million hospital visits. They found that the rate of hospital-acquired complications for patients increased by 25% at hospitals that were purchased by private equity firms. That increase was driven by a 27% increase in falls at the hospital, which tend to happen on the general hospital floors, a 38% increase in central line infections. I'll tell you what that is in a minute. Those are associated with ICU care, and a doubling of the rate of surgical site infections. That's like horrible. The increase in central line infections happened despite private equity-owned hospitals inserting 16% fewer central lines. What those are is those are ports that are inserted into large veins that are surgically implanted in the patients who need regular intravenous food or medication or fluids, so they don't have to keep poking them with a needle. Those things getting infected. That's never supposed to happen. Okay, contrasting the rise in adverse events was a very minor decrease in hospital deaths among the acquired hospitals, and the researchers they felt obliged to look into that. They wrote that the apparent improvement could be the result of the hospitals, since they were private equity, they were taking a pool of patients that was in general healthier and had higher income than previously. So that's possible. The other thing was they discovered that private equity hospitals were discharging relatively sicker patients at higher transfer rates. So that's actually documented. They were shipping them out to other hospitals. That would lower their mortality rate because those people would die at other hospitals. This is not a charming subject. Anyway, it turns out that the post 30-day mortality rate, so once you're discharged, they see, are you still alive? No difference between private equity and other hospitals. Private equity and other for-profit hospitals. So look, dumping sicker patients to other facilities and obtaining lower mortality rates. We have a phrase for that in the medical world. Yuck. That's the data for now. I want to point out that the U.S. Senate Committee on Labor and Health is investigating exactly this situation, private equity in healthcare. I called them and I spoke to the committee's office because I wanted their data. And they said, it's not ready yet. The senator in charge is Ron Wyden of Oregon. He will post the results of their investigation. When he does, I'll make them available here. Okay, that's it for today. Have a good afternoon. Oh, below, like, share, and subscribe. And if you click on that newsletter link, you have an opportunity for free, it's free, to subscribe to the daily newsletter coming into your email. Okay, have a great afternoon.